So a lot of people here, I think it's not your first time at SIHI Talks. I've seen a lot of familiar faces, familiar names, and also those from the SIHI network. So thank you for joining us here on SIHI Talks. I hope you can see me and hear me all right. So my name is Julia. I'm from the SIHI Global Secretariat. So before we begin, I know we are joined by registrants from all over the globe. So please go ahead and use the chat box to say hi, introduce yourself, and where you're joining us from. So again, my name is Julia, and I'm joining in from the Philippines. So maybe you guys can start off on the chat so we can know where everyone's coming from. Okay. Is everyone hearing me all right? All right. We have some from AHRI in South Africa. Hello. And from Geneva, of course, Michael from TDR. It's great to have you here. Guatemala, good morning. Yes, very early morning in Latin America. And here in the Philippines, it's already evening of the 23rd. And Kenya. All right. So thanks, guys. It's great to have you all here on Zoom. So for before we actually start this session, I do have some reminders. So first is to please keep your mic on mute unless speaking. So we all know we are all very familiar with this, especially on Zoom. Second is we'll open the floor for questions and reflections later, but you can also drop them on the chat as the presentation goes along. Third is that if you experience any tech issues, just like we did, or if you know someone who's having trouble entering the meeting, please message me or the CHI account and we'll do our best to assist. And lastly is that this session is being recorded and live streamed. So if you prefer not to be seen, please feel free to keep your video off. And since it's recorded, you can revisit the playback anytime once we've uploaded it on YouTube. All right. So let's go back to the poster slide, please. Today's session is a bit different from the previous ones, which were more a bit of a lecture type. But today we're introducing something and some people that I think will really resonate with many of us in the CHI network and those who are passionate about social innovations in health. So they are a team in the Africa Health Research Institute, or AHRI, in South Africa, and they are hosting the AHRI Health Hack, Infectious Diseases Edition, which will happen October this year. So we actually got connected to them through Beatrice Halpa from TDR and also Dr. Joe Tucker, who I think I saw him enter the room, who you may know leads the CHI China Hub at SESH Global. So Joe and his team have done incredible work around designathon, and designathons can be considered somewhat interchangeable with hackathons or something very similar to it because it brings people from different sectors together to co-create social innovations and really drive design thinking. And let's see how we even have a practical guide on designathons, which I'll send the link in the chat in a bit after I finish talking. So when we got to know about AHRI Health Hack and their team, we saw a lot of alignment with the work we're doing across the network. So just like us, they're working towards an ecosystem where researchers, community members, developers, and maybe policymakers can intersect and work together on solutions that address public health needs, especially around infectious diseases. So this CI Talks is a great opportunity not only to participate in the health hack, which we encourage, but also to explore how CHI hubs and your organizations can collaborate and maybe even adapt or co-host similar formats in your own contexts. All right, so whether you're thinking about participating or sharing this opportunity to your circles or co-developing something similar, there's a lot of potential here for learning and collaboration. So yeah, I'm looking forward to the connections, and I think I can call on now Dr. Alison Castle or Ali to kickstart our conversation.
Excellent. Thank you. I'm actually first going to go ahead and share my screen, but thanks for so many folks showing up today. We're delighted to be here to have the opportunity to talk about the Africa Health Research Institute and also tell you a little bit more about this initiative, the AHRI Health Hack. So as Julia mentioned, my name is Allie Castle. I'm an infectious disease physician, primarily based at the Africa Health Research Institute in South Africa. And I am joined today by Munya and Noma, who I will let introduce themselves. Turn it over to you, Munya.
Thank you, Alison, and good day, everyone, morning, afternoon, and evening to others. As Alison said, and I've already written on the chat, my name is Munya, joining you from South Africa. Thank you. Noma, to you.
And my name is Noma Tamsanga, but they call me Noma in short. I'm also from the Africa Health Research Institute in South Africa. Thank you.
Excellent. So just for some disclaimers, I receive funding from National Institutes of Mental Health and the Paul Farmer Collaborative, and the views and opinions expressed today from Noma, Munya, and myself are our own and do not necessarily reflect the Africa Health Research Institute. And for an overview for today, we're first going to start with some context about the Africa Health Research Institute, which is based in the province of KwaZulu-Natal, South Africa, hearing from Munya about the organization and our trainees. Then Noma is going to describe some of our community engagement and social innovation projects at the Institute, which has been going on for 25 years. And then I'm going to share some more details about the AHRI Health Hack, how you can get involved or may want to adopt this model at your own institution. So I will turn it over to you, Munya.
Okay, thank you. So I'll just go through a few slides. As Alison said, we are based in South Africa. We have two campuses, one of them based in Durban at the Medical University of KwaZulu-Natal, and the other campus is based at in a rural part of the KZN, which is called Somkele. It's in the northern part of KZN. And AHRI is a research institution. You can move to the next slide. Or am I able to control from my end? Okay. So I just thought to give some background, we share our vision, which is optimal health and well-being of under-resourced population. And this vision for us, it resonates in the areas that we work and the kind of population that we conduct research in the communities that we conduct research. So it is supported by our mission, which is transdisciplinary scientific research to understand and intervene on diseases. I think I've lost the presentation from my end. We do have our values, which guide or anchors us in our day-to-day activities, both internally and externally. Our values are Ubuntu, which is a concept in African contexts, which loosely translates to you are because I am. In other words, what I do and what you do, it does in fact how I live and what I become or how I conduct my day-to-day. We are about transformation that is translated in the research that we do. It's supposed to transform the people's lives. We echo leadership skills, innovation, which is why we are involved in a project like this, the Health Hackathon. We're looking for innovative ways to influence and impact public health, excellence in both our laboratory internally and in the public engagement work that Noma will talk about. And collaboration, we're big in that. It's one of our core values. We're big in that we understand that on our own, we are not able to make impact. But if we work with networks across the continent and across the globe, we will be able to make more impact. If you go to the next slide. So here we are a non-profit organization, which in simple terms, we don't work for profit. We are not a standard university as you consider, but we intersect between academic, social, or community related, as well as research and clinical trials. We are governed by a board of directors. We have a scientific advisory committee that also supports our executive committee. The structure shows that we have got domains in the science that leads our research areas. We have basic and translational science, which is discovery research. We also have clinical trials, and I must say that it's one of the unique environment that the clinical trials is set in the most rural area of South Africa where resources are limited, and this was designed on purpose to really bring healthcare and services and research closer to the people who need it the most, the under-resourced population. Implementation science and population science, which is, as Alison said earlier, has been going on for over 25 years. This year, we're celebrating 25 years of population science, mainly the health, demographic health services. And then this integrates with social science to understand behaviors and other determinants of health. We have got a business unit, which I won't go into detail, which supports all the personnel that you can see on the bottom right of 800 people that are split into 2 campuses. We have 33 faculty members that are based some are based in South Africa, some are based in other parts of the world. And one thing that we're really proud of is training the next generation of scientists. At the moment, we're counting 99 trainees, and this is important that we recognize their relevance even for the hackathon, because this is where we are encouraging space for innovative engagements, innovative products, and also a launch pad for them to be able to work and develop their own independent identity as far as research is concerned. So collaborating with other researchers, be at peer level or senior, who will then encourage that participation and networking will be key for this the next generation of scientists that we are busy training with the 99 currently on count. If we go to the next one. I just thought I would give you a snapshot of the splash of our faculty members. You can see it cuts across demographics, young senior people across the globe with affiliations in other academic institutions globally. And these are the ones that are leading our science work. If you could move to the next one. So this is our science strategy. We basically conduct our research in 3 research content areas: infection, which is mainly HIV and TB, adolescents' mental health, and climate and health. The adolescent mental health and climate health are relatively new in our strategy. The HIV and TB has been in the research value chain of AHRI for many years, but we have now introduced adolescents' mental health and climate and health. This is in collaboration and in engagements with our communities, responding directly to the circumstances around ourselves and the needs of our communities. As I said earlier on, our vision is about well-being, health and well-being, optimal health and well-being of under-resourced population. So through our public engagement, which Norma will refer to earlier, we do engage, and the adolescents' mental health and climate health were outcome of this. And all these research areas, they cut across the functional areas that are listed below, and I won't go into talking about all those in the interest of time. And the next slide for me. And this is just to show in a graphic manner how the 3 content areas or research areas interfaces and integrates across, so that if we're talking about infection, we can link infection in adolescents and mental health, and in climate, how in climate health can impact on people with HIV or people with TB. So just to give, but those are the areas that when we go into the hackathon, the session that we're presenting about, Alison will talk about that. Those are the problems that we are trying to solve. We could move to the next one. Again, this is just to further elaborate and give complexity of where we work in and understanding that there are other areas outside that AHRI can control. Then we bring in our expertise from either outside working through the networks, and again, building with the strong build of our faculty members. And I think I'll pass on to Noma after this. Thank you. Oh no, I still have two more, sorry. So I think just to show about the impact, what we really look to come out of our research work and also coming out of the hackathon. We work towards building critical knowledge and also translating policy and practices. We engage very closely with the government of South Africa and again in other countries where we do have collaborators. So the outcome of our hackathon meeting in October, we hope that it will lead to, again, critical knowledge generation and influencing engagements on policy and practices. Thank you. Thank you, Noma.
Thanks.
Over to you.
Thanks, Munya. So as Ali and Munya has indicated, we have two campuses and our public engagement activities are across both these campuses. Can you go to the next one? So public engagement at AHRI includes activities and projects that allow for open communication. It is a platform for our scientists to engage with the public as well as the stakeholders. And at the center of our research at AHRI, we have our Vibrant Community Advisory Board, which ensures that the research that we do in the community is both ethical and culturally appropriate. So we also encourage our scientists to be part of the engagement, to lead the engagement activities so that they can be able to inspire the next generation of scientists through schools engagement and also through co-creation of studies that are relevant to the community. As Munya has indicated, that some of the areas that we research came from the community whom we engaged. So we really make sure that our scientists are engaging directly with our community so that research can be informed by the needs of the community that we serve. Next slide. So as I indicated that our CAP is at the center of all the research that we do at AHRI, we ensure that they contribute towards the entire life cycle of research at AHRI. So at first, when we are setting research priorities and generating ideas, scientists come to the CAP and do scoping exercises that will inform the studies that are going to be undertaken. And also when we are doing our clinical trials, we ensure that our CAP review and review the protocol and contribute towards the design so that the needs can be met when the clinical trials are undertaken. And also, as soon as the studies are completed, the first point of interaction is also with the CAP, where the scientists engage during the preliminary result phase, so that by the time the results is disseminated to the wider public, they have gotten the input from the CAP. Next slide. As indicated before, that the scientists are also at the center of inspiring the next generation of scientists. One of the vehicles that we use to engage with the school learners, whereby they engage with the scientists. The pictures here are showing different activities that were done with the school learners. Some of them were used for creating the products that will be used to disseminate study findings from the youth studies that are being conducted at AHRI. And some of them are used when we are looking at the activities that will talk to the studies that are still taking place at AHRI. So this platform may assist us in getting views from the youth and have youth-friendly products that will be consumed by the youth at different stages of their lives. Next slide. And this slide is showing some of the innovations that we used as the public engagement unit at AHRI, whereby we had to develop products that were translated into isiZulu, which is the local language that can be understood by the public that we work with, so that we can be able to assist with behavior change. For example, the one on the left is showing us what we did when we at the COVID-19 period, where we were interacting with the people, with the public and communities, making sure that they understand what is expected of them to assist in the fight against the COVID-19. And the picture on the right is showing the product that were developed with the learners when we were disseminating study findings for youth studies that were conducted at AHRI. Next slide, please. This slide is just a snapshot of some of the innovative studies that have taken place at AHRI, including the first one, Vukuzazi, is when a population was used to get information about diseases that are at AHRI, and this is used as a baseline for most of the studies that are in this slide, like the evolved hepatitis B was coming out of the Vukuzazi study that was done at the area where we are functioning. And I will be talking in the next slide on one of the innovations that is being done at AHRI, which is Thetha Nami, Ngithethe Nami, Ngithethe Nawe. It means talk to me, I will talk to you. So Thetha Nami is a robust peer-driven platform that delivers HIV prevention via relatable storytelling, digital tools, and the use of safe spaces for the youth, whereby the youth will be empowered to lead their own health. So as it is peer-led, we use our peer navigators who can be able to relate to the youth and the way they live in their respective communities. So it is a holistic biosocial model which combines biomedical intervention with social behavioral mobilization. And through co-creation, we ensure that youth own this project and they are able to deliver any product through delivery to adaptation. In that way, we also make sure that we have, you can see the picture on the right, that we have the mobile clinics that are stationed next to the places where youth can feel safe to go and interact with the study teams and be able to be open and also assist towards the implementation of the study when it comes to the community. So I'm sure by these few examples, you'll see that innovation is really one of our values at AHRI, and we ensure that whatever we do, we engage the community when it comes to co-creation as well as delivery. I will hand over to Ali. Thank you.
Thank you so much, Noma and Munya. That was fantastic. So now that you've heard a little bit more about AHRI's really context and research priorities and some of the studies that have been ongoing, I am very excited to share details about the upcoming initiative, the AHRI Health Hack, which we do believe exemplifies social innovation. But for those of you who are unfamiliar, I want to just start with, what is a hackathon? So it's basically a collaborative, fast-paced event where people from different disciplines get together to solve a common problem, and it usually lasts around 24 to 72 hours. And the goal is to move from an idea to a proposal or a prototype quite quickly, guided by mentorship and through teamwork. And as you'll see from this image, the event really starts with problem generation. Basically, individuals get up with sticky notes and they state on that first evening what they think is the leading challenge or issue in their field. Following this problem generation, then teams of 5 are sort of formed organically. So participants get to choose who they work with and what they work on. And then they spend the next 24 to 36 hours hacking out their problem, shaping the idea or the solution, while receiving feedback from mentors. And on the last day, they give a 5-minute pitch to a judging panel, sort of like the TV show Shark Tank, if any of you have seen this. But essentially, this is a competition. So there are winners and runners up for a monetary prize. And that money is really to contribute to the collaboration and the ongoing proposal that some of the strongest teams have created. And I'll just say this idea really blossomed from when we hosted MIT students from the United States at the AHRI Health Research Institute. During their visit, we gave them 24 hours to develop ideas and teams on how to solve the HIV epidemic among young people in the region, with the last day culminating in a 5-minute pitch to a panel of judges, some of whom I see are on this call. And the ideas were extremely creative and could have led to multiple new science proposals. And I'll just say that the students really enjoyed the experience enough that they came back and approached us and asked if we wanted to host a hackathon event at AHRI. So we are partnering with MIT HackMed, as they really are the global leaders in hackathons. They've led these health-focused hackathons in over 30 countries, from Boston and Geneva and Mexico. And so we asked ourselves what would happen if we brought this spirit to rural South Africa, really focused on our trainees at a research institute, and also sort of more focused on, I'll call it a grantathon, or generating new science proposal ideas for those involved. And of course, sorry, my light went off. This isn't just about being trendy or importing a model for its own sake. We are doing this because we've noticed a challenge in the scientific space. I'll just say, too often, scientists, clinicians, engineers, public health experts, we work in silos. We are trained in silos. We attend conferences in silos. And unfortunately, that does mean we often solve problems in silos. And when it comes to things like HIV and TB or other emerging infectious diseases, I think this fragmented way of thinking really does hold us back. We have also learned, or I've heard time and time and again from early career researchers, that they feel that they're unsure about how to build cross-disciplinary collaborations, even within AHRI. They're not necessarily confident about how to pitch their ideas to funders, and they rarely get structured opportunities to do so. So this is our attempt to change that. It is, hopefully going to be a space where someone studying behavioral science can sit across the table from a biomedical engineer, and by the end of the weekend, they have prototyped or developed something together. So it's really about seeing what happens when we remove the usual barriers to collaboration. And our vision is fourfold. First, we really want to catalyze interdisciplinary ideas for science proposals. So like I said, this is a grantathon in a sense that we're hopeful the ideas generated by teams will lead to future work to improve what we know about infectious diseases in the region and how we address them in the healthcare setting. And we know that most of the most exciting and fundable research really happens at the intersection of fields. And so we are intentionally creating this space with a hackathon. Second, we do want to foster collaboration between early career scientists and diverse sectors. So this means making a space for young researchers to work alongside from folks in academia and private health startups or tech developers, as I think it can be a job-seeking opportunity for our trainees to really see what lays beyond the normal academic tract. We also want to spark a pipeline for impactful or fundable research. So this is an exercise. It's a fast-paced 48-hour event, but if it is successful, specifically in the networking and the idea generation for our trainees, we would like to continue these hackathons at AHRI to really promote sort of novel ideas and research. And lastly, we want to strengthen networks across academia, government, industry, not just for the trainees, but really all involved, including those of you on this call. So in short, our goal is this is not just to host a fun event, but really to shift the way that we're generating ideas and building teams. So some of the event details, as you've heard from Noma and Munya, our theme will be, for this event, will be infectious diseases. One of the things you maybe didn't come through is clearly South Africa, and specifically the region where we work in KwaZulu-Natal, has some of the highest rates of HIV and tuberculosis globally, which is why a lot of our faculty focus on these diseases. The dates are October 10th and 11th of 2025 this year. We'll be gathering at the Gateway Hotel in Durban, and we will be inviting 100 participants to take place. They'll be supported by 15 mentors and those mentors some of them will be from the Africa Health Research Institute faculty, but others from academia and design backgrounds will be invited, and they'll be judged by a panel of 5 professionals. And the judging criteria, we've really pulled this from the MIT HackMed structure. First is on how high impact is the problem that the teams are addressing, how innovative is the idea or the solution, what's the feasibility or the budget of the proposal, what is the clarity and professionalism of the pitch, and lastly, which I think is a very important judging criteria, how diverse are the skills and the perspectives of the team members within the team. And so we're not looking for final products, just looking for really ideas that are grounded in context and built collaboratively. So why participate? Well, first, this is a chance to work with people outside your discipline to address HIV and TB and other infectious disease challenges in South Africa. For all of you who are outside of South Africa and interested in focusing on these diseases, I think this is a great place to meet new and upcoming African scientists thinking about how to collaborate for future grant ideas, especially if you don't already have those connections. For trainees, building skills and pitching to funders and working in teams is really invaluable, and you will get structured feedback on your ideas, on your proposals from these mentors, which isn't often something that happens in real time, but does allow your ideas to be shaped into a more successful grant. And thirdly, this is about growing your network. So you'll be meeting with other early career researchers, local and international mentors, and possibly even future collaborators. And so we have learned, while we haven't attended an MIT HackMed event, we have learned that the most powerful outcomes are not necessarily the application or the devices or the proposal created, but really the connections formed between people. And so that's what we're trying to create here. And why sponsor? So for those of you representing institutions, funders, or partners in this space, you might be wondering what your role could be. And I would say that sponsoring the AHRI Health Hack is a powerful way to demonstrate you and your brand's commitment to innovation and equity. You'll be able to connect with leading African investigators who are working on the ground in these high burden areas. You'll be supporting the training and capacity building for the next generation of scientists, and of course, gaining brand visibility along the way. But we're not just asking for funds, we're asking you to join us, whether that's as a mentor or a judge or a participant or a partner. I do think this is an opportunity to become a part of something that's really focused on community-driven change in South Africa. So we have worked hard to keep the event efficient and accessible as possible. So you'll see our total budget is 800,000 Rand, which is around 45,000 USD. This covers accommodation, local travel, food for participants, mentors, and organizers across the 2-day program. It's really enough to ensure that everyone can focus on creating without having to worry about transportation or meals. And we have set the participant fees low to encourage broad participation. So early registration is 500 Rand, which is about $28, and late registration is 800 Rand. And really all of this goes towards covering the accommodation fees for participants. And for organizations who do want to send teams, we are offering a 10% group discount to lower that barrier even further, because we do want students from underrepresented institutions, junior staff, young professionals to be able to join, and sponsorship makes that possible. And we've created sponsorship packages that allow organizations and individuals to really get involved in this initiative at different levels, depending on their capacity and interest. So these packages do include tangible benefits like logo placement on printed and digital materials, engagement with the participants, including providing your own named prize in addition to the winner and runner-up prizes. So if your organization wants to have something labeled as your own prize, you can help support specific teams based on your own criteria. We also offer speaking opportunities during the event. So anywhere from 5 to 15 minutes to really speak about your organization, about what kind of innovation you're doing, or what product you have, And there's also an opportunity to have a seat at the judging table or a chance to serve as a mentor. And I'll say that the goal is not just to make sure that our sponsors are supporting the event behind the scenes, but actually becoming a part of it. We want you in the room, we want you in the conversations and really shaping the energy of the event alongside the teams. So I'll say if you are interested at all in learning more about this, I have my email on the next slide. And so please don't hesitate to reach out to me directly. And just to close, I see we're right at 30 minutes. If any of this has sparked ideas for collaboration or you want to learn more about our hackathon, please don't hesitate to reach out. Like I said, my contact information is here and I'd be happy to talk more. And for all of you across the world, thank you for listening. At AHRI, we really do believe that innovation doesn't just happen in labs or in boardrooms. It starts in the community, as you've heard from Noma. And yes, hopefully it will also happen in this 48-hour hackathon. So we hope you will join us. Thank you so much. And we are happy to take any questions.
Yeah, thank you so much, Alvi, Mamunya, and Noma. It was really interesting for me to hear about what the Africa Health Research Institute does. And I agree, and I fully agree with what Alison said. And of course, that innovation starts at the community. So, like I said in the beginning, we're gonna open the floor for questions. And also, Dr. Joe, also, maybe you'd also like to speak and share more about what's been going on the chat if you're available.
Hi, Julia. Hi,
Hi there.
Allison. Thanks so much for that presentation. It was really fantastic. And I think what you guys are putting together is really exciting. It's not, I mean, I think the form of like hackathons, designathons, it's evolving and we're trying to figure out like what the right way to do it is. But I think the best way to do it is sort of try and iterate. And AHRI has a tradition of bringing together really fantastic people. So I'm confident that you guys are going to do something really exceptional. And I would encourage everyone who's sort of in the area or where this might be feasible to think about it. I have a question. It sounds like this is 100% in person, right?
Yeah.
And are you so and the groups that are coming together could be students, they could be professionals. It's like the idea is to kind of get a broad cross section of people. Are there in terms of getting people, like I think by virtue of being AHRI, you'll probably have stronger links to like health and medicine. But in terms of getting like private sector individuals or people from civil society or government, have you been able to make inroads with other sort of sectors and develop partnerships with other sectors outside of health and medicine? Just curious. Over.
It's a very good question. And I might actually turn it over to Noma and Munya just to say, as a research organization, we already actually we have very strong ties with civil societies and the government and other industries. And so it's not because they're already engaged in what we do at AHRI, those conversations are starting, but I might just turn it over to Munya to expand a little bit more on the sectors we are approaching for this event in the area.
Okay, yeah, thanks, Alison, and thanks, Joseph. It's a very good question. So we do have a strong relationship with the government, in particular, the Ministry or Department of Health and the Social Development are the primary ones that have expressed interest to participate and be send colleagues from government side. And also at national, we have extended this to the departments that we work with within the Ministry of Health. And private sector, we have also, we're still within the government structures, also at local government. There is strong interest both in the Mtuba, the Northern KZN, and they are looking at sending participants. We are also looking at them contributing to an extent because this also strengthens our partnership and collaboration with them. We do have private sector that we have sort of earmarked to start engaging with. So our process of engagements and calling out for participation, we're working on it until the end of August. But there has been some strong interest even in academic institutions that we have engaged with as well. UKZN is one of our strategic partner, and they are also interested in partnering with this. The University of Zululand, which is in the north, one other area that they are also interested in joining and will be sending participants as well. Thanks. Yeah. And communities, we work, like Noma said, we have got several structures, formal structures, the civic society in the KZN, the civic society. They are very vibrant and active, and we are engaging them as well. Thanks.
And Joe, I might just add, I know you have done many of these events, and we've spoken about this before, but because we are partnering with the MIT HackMed folks, they actually have a lot of materials to help guide us, not only through the program and how to run the event, but of other like Samsung and other J&J and other sort of medical industry in the United States. And so we're also approaching those sort of more industry focused folks who have funded hackathons previously. I think having those connections is very important.
Yeah, definitely. And I also feel like South Africa is a place that like there's a lot of social innovation going on. There's a lot of like tech innovation, just as like as a place to host something like this. I think it's a great spot, and in some ways just like the environment and some of the horizontal connections would be really useful. Yeah, it's exciting. Thanks, guys.
Yeah, thank you. I also have a question. Since the hackathon is directed to infectious diseases, so if someone were to participate as a participant or a mentor, what kind of challenges or themes could they expect? Would it be similar to the innovations that you presented, the HIV, COVID, or are there specific infectious diseases that you're targeting?
It's a really good question, and something that we've been thinking about actually for a while and we've learned from our colleagues who have run these hackathons before that you really do need a theme, and you can have multiple tracks and different themes. So we could have had, for example, an HIV tract and a TB tract, but then you really do need at least 50 to 100 participants per tract to make it successful, to have enough people there to be in competition, to form teams. And because of the epidemiology of where of how common HIV and TB are, it's the reason why we sort of combined into one track and had this focus on infectious diseases. Now it can include other things like HPV or COVID-19 or other infectious diseases. We kept it a little bit broad. And so it's really up to, in that problem generation phase in that first night, of whatever trainees or whatever people the participants are interested in, they can get up and say, this is, the specific problem within, HIV prevention or HPV vaccination that I want to focus on. And then those teams form after the fact. And so we're trying to keep it relatively open, but it is still a pretty broad category. And it really reflects what the majority of our trainees and faculty do at the institution, which is predominantly focusing on different infectious diseases. Good question.
All right. So is there any other questions from the audience? You can unmute your mics now or raise your hand.
I do have a question.
Yes, please go ahead.
Hi,
And
I
please
think
introduce yourself also.
sorry. Hi, I'm Gloria Sukali. I'm a PhD fellow based at the Africa Health Research Institute in Durban. And thank you guys for such a lovely presentation because I think I was curious to try and find out exactly what to expect for those 2 days. And it's a very interesting and innovative ideas that you guys have put together. I just have one question. I had just emailed it to Alison shortly, but anyways, I might as well just ask. I wanted to know when can we get feedback or when should we expect feedback for the ones who submitted their applications of interest? Because this is in October, so we'd like to plan ahead with our supervisors to tell them that, hey, you know, that's what I'd like to know. Thanks.
Great question, and thank you for all of the AHRI participants who joined. This is actually one of our first steps in giving a more a broader conversation about this event. We're still sort of ramping up our dissemination within and outside of AHRI. And so, Gloria, what I can say is that we are reviewing the applications and we'll plan to have a response to you by the mid to end of August. If that's helpful for planning. We're also
Yes.
involving everyone's supervisors. The faculty will be a part of this event, and so I don't want you to worry about that being sort of a barrier. Yeah.
Okay, thanks. Very helpful.
Yeah, I saw in the registration we have a lot from the Africa Health Research Institute. So if there's more questions also from your organization, you would also love to have them here. But of course, you can also contact Allison on the slide. Her email is there. Okay, last call, I guess, for questions.
If it's okay, could I ask a question to the group? Unless
Yeah,
others...
of course.
I'm curious, for those of you who have hosted hackathons, we're really using this sort of structure and approach, like I said, that our collaborators have used, the MIT HackMed, but I am a little bit curious, and I'll take a look at the links in the chat from the designathons about, what you have learned previously, what works or what doesn't work with the designathons or hackathons you've hosted previously, and if you have a similar format in the structure of how the event is hosted.
So that question is open to all. I have sort of an idea, but maybe Dr. Joe can start. I see you, so you open this camera.
It's a good question. And I would say, I mean, even the definition of like what is a designathon or a hackathon, people define it in different ways. And we've defined it as sort of like a three-part process where the first part is some open call or something to kind of get solicit like community ideas or people and people. And then this intensive collaborative event, like you mentioned, and then the follow-up that's sort of like the final part. And I think it's in my kind of looking at the literature and being involved in these events, I think one important thing is to kind of put on your end user, like try and view things through your end user lens as much as possible, so that in terms of if you're recruiting mentors or facilitators, trying to like walk with them and be really explicit about what you're looking for. If it's like a group of, and oftentimes, the facilitators, like for each small group, it might be nice to have one person in each group who's actually like a facilitator, where their primary role isn't, it's not that they've signed up as a participant, but they're actually like an RE person who's sort of who can help steer the discussion, who Um, and although I would also say the form of like hackathons is common enough now that you may very well in your 100 people have a few people who've participated in enough of these kinds of events to actually be kind of facilitators. Um, and then for mentors, having like a diverse group of mentors that have like a specific thing that they're gonna be like going to each group, like a communications person who would help each group to think about communication, or like a physician or a person, a local person from the neighborhood in where you guys are to kind of have like an end user perspective. Um, and then it's really like, it's also the follow-up part, I think, is really important. What's your definition of success? And um, you can link it, or if it's possible to link your prizes directly to what you want to happen afterwards. So like, for example, if it's research, if this is about catalyzing research, instead of having a prize that's like a kind of prize where it's like, good job, here's your prize, it's more like, this is actually a seed grant to do research, and it's not going to be like, you get the check, you get the check cut. It's more like you have deliverables, and like at 6 months, you'll get, the first tranche of money. And then at 12 months, when you do what you said, you get the second tranche of money, so that it's not like I mean, it becomes more like a pathway into a grant and less like a random ad hoc thing. And I think the other thing, like in that vein, would be, I'm sure you guys already have great connections with the South African MRC and like South African funders, but if it's possible to kind of get some of the funders on board, even if it's not funder money, just to kind of have them understand what a hackathon is and see how, ooh, actually, this is a way not only to like kind of grounds up innovation, but there's also very much a role for like wise senior people who are funders to be judges, to kind of have like their strategic insights, help and push things forward. So I think I mean, that's another kind of fun thing just to be part of it, so that like the researchers can actually meet some of the people who are funders and in these different positions. I think that's another like value add for participants. Um, um,
Those are great
yeah.
ideas. We've been going back and forth about the prize on whether we let the teams, divide it up and fully decide what they want to do. But this is really truly focused on proposal generation. And so I like the idea of forming those prizes into seed grants. I think and everything else you mentioned too, including SAMRC and other funders. Welcome other folks who are invested in our institution and in our research. We should have them be a part of the judging panel potentially if students are presenting and want the opportunity to be able to present a pitch to a funder. We should have those funders be a part of this process. So it's a very good point.
Yeah, and I initially had insights, but I think Joe said everything that I wanted to say, and I couldn't have said it better myself. Yeah, but in the hackathon that our team did before, we had the actual organization um that provides, for example, the HIV services. So they also have to be in the room so that um the innovation really gets to be implemented, because we're aligned with what they need, and they also look forward to what the participants are presenting, so that there's a clear trail transfer from the idea to the implementation. All right, so I think um that ends our session since it's almost time. And of course, some final comments from Dr. Joe. And of course, for the rest of our audience, if you have final comments, you can share them there. So I think those were some great insights from everyone. So can I ask Amara just to flash her final slide, if she's there? All right. So thanks everyone for participating in this session of SIHI Talks. And thank you to the Africa Research Institute for telling us all about this exciting hackathon and all the great things you're doing and how we can contribute. So I think if also anyone else wants to share contact details to connect, you can do so on the chat. And if you'd like to know more about SIHI, you can visit our website or any of our social media pages as you see on the top of the screen. So on the left QR code, that's for our survey if you'd like to give feedback on today's session. And on the right QR code, that's the registration form for the Health Hackathon. So you can scan away, and all previous SIHI Talks episodes are gonna be on SIHI's YouTube channel. So once again, thank you so much for attending. We'll keep this slide on for scanning and for some final comments. So thanks everyone.
Thank you.
Thank you and bye.
Thank you.
Thank you. Bye.